Welcome to CyberIntel Digest, where we uncover creepy cybersecurity stories and the chilling side of technology. Before we dive in, make sure you hit that subscribe button and turn on notifications, so you don't miss any of our deep dives into the shadows of the digital world. Tonight, we're stepping into one of the most terrifying real-world cyber horror stories, when a hospital, a place meant to save lives, became the victim of a ruthless cyber attack. Imagine lying in an ICU bed, machines keeping you alive, and then, suddenly, they all go dark. This isn't science fiction. It happened. And what unfolded shocked the world of medicine, cybersecurity, and law enforcement. Hospitals are supposed to be safe. The beeping monitors, the hum of ventilators, the quiet efficiency of nurses and doctors working around the clock. But behind that calm exterior is an invisible nervous system, computers, servers, and networked medical devices. Unlike any nervous system, it can be attacked. In September 2020, Düsseldorf University Hospital in Germany became ground zero for a cyber horror story. What started as a regular day turned into a nightmare, a ransomware attack that crippled critical systems, locked doctors out of patient files, and forced the hospital to turn away emergencies. And tragically, a patient's life was lost. The attackers used ransomware, malicious software that encrypts data, holding it hostage until a ransom is paid. In this case, the ransomware infiltrated 30 servers, knocking vital systems offline. Doctors couldn't access lab results, nurses couldn't view patient records, and ambulances had to be redirected. One patient, in desperate need of urgent care, was rerouted to another hospital, costing over an hour in critical treatment time. That patient died. And suddenly, what had been dismissed by many as just cybercrime became a matter of life and death. The ransomware group behind the attack had no idea they'd hit a hospital. When German police contacted them, the hackers actually pulled back the ransom demand. They claimed they thought they had targeted a university, not a medical center. But the "oops" moment didn't undo the damage. Systems were down for weeks. Investigators later discovered the group was tied to a larger criminal network selling stolen data and cyber tools on the dark web. This exposed a chilling reality: hospitals are prime targets. Patient data is valuable, worth more than credit cards on black markets. And ransomware attacks are brutally effective, forcing institutions to choose between paying millions or risking lives. Think of what this means beyond just one hospital. Patients denied care. Surgeries cancelled. Families kept in the dark because doctors can't access records. The trust we place in medical institutions, that they'll always be there to help, is shattered. And it wasn't just Düsseldorf. In the same year, over 400 hospitals in the US were targeted. Some paid ransoms in secret to get their systems back. Others tried to fight back, but the downtime cost lives, billions of dollars, and lasting trauma for staff and patients alike. Beyond shutting down hospitals, hackers know medical data is gold. On the dark web, a single patient file, with medical history, insurance, social security number, and prescriptions, can sell for hundreds of dollars. Why? Because it can be used for identity theft, insurance fraud, or even blackmail. Imagine receiving a message from a hacker who knows your deepest medical secrets, mental health records, genetic results, private treatments. That's not just financial harm. That's psychological warfare. But why hospitals? Because they're the perfect storm of vulnerability. Many run on outdated Windows systems. Medical devices, like infusion pumps and MRI machines, are often connected to networks but can't be patched. Staff are trained to save lives, not spot phishing emails. And budgets are stretched, leaving IT security underfunded. Cybercriminals know this. They know that if you cripple a hospital, the pressure to pay the ransom skyrockets. And sadly, many do. The Düsseldorf case was the first time a ransomware attack was directly linked to a human death. And it won't be the last. Hospitals remain targets, and unless cybersecurity is treated as life or death, more tragedies will happen. So what can we take from this? Protect your data. Support stronger cybersecurity in critical institutions. And remember, the scariest monsters aren't hiding under your bed. They're behind a keyboard, in the shadows of the digital world. If this story disturbed you, subscribe to CyberIntel Digest. We cover the real-life horrors of cybersecurity and the dark side of technology every week. Stay safe, and stay alert.